Hello and welcome to Studio 67 here on Nash Community College campus. I am Andrew Small, the Director of Instructional Media here. And joining me today is Hank Raper, Town of Nashville Manager of Town of Nashville, and Police Chief Thomas Bashore of Nashville. Good morning. Good morning. What we wanted to talk about today was basically introducing yourself as the new Town Manager of Nashville. So how would you like to tell us about yourself?
Well, thank you, Andrew. I'm Hank Raper. I've been the town manager of Nashville since early October of 2015. Came originally from Danville, Virginia. It's where I grew up. First 18 years of my life before going off to college. I enrolled in Bowie's Creek, at Bowie's Creek, Campbell University in the fall of 2007. Was a double major in history and public administration. Continued my studies at North Carolina State University, received my master's in public administration, and a Juris Doctorate degree in May of 2015 from Campbell University School of Law in Raleigh, North Carolina. Along that way, I gained experience working with the town of Irwin and the town of Pittsboro in the management internships, and an intern in Apex, North Carolina, and assistant to the town manager also in Apex.
Fantastic. How are you enjoying the town of Nashville so far?
I've really enjoyed my time here in Nashville. I've really enjoyed meeting the people in the town, working with the town council, working with town staff, and it's been a great experience.
Fantastic, fantastic. And I know, and welcome, absolutely.
Thank you.
And I know one of the reasons that well, we're starting this show is to bring about information coming from the town manager, and the many people who work for the town of Nashville, to present some news and information coming straight from the source, actually, instead of social media and things like that, but right. Hosting a show so that we can bring about information that is of interest, of public interest, of community interest, and great things like that. And one of the things that we wanted to talk about this morning was a brand new initiative that the town of Nashville has initiated, especially the police department, which is the HOPE initiative. And if you'd like to talk about that.
Well, let's start that off with our police chief talking about our HOPE initiative. I guess I'll just introduce that very briefly.
Please.
I discovered a similar program in Massachusetts and saw it on the news and several different outlets, and saw some very positive feedback to really addressing a serious heroin problem that they had in Massachusetts in the north. Not a problem that's significant in the town of Nashville, but something that really illustrated the need to get into the community policing, some way to make a positive difference in the community. And with that, I'd like to turn it over to the chief to really go into the details of our program.
Yeah. The HOPE initiative, again, was based on an ANGEL program that Chief Campanello introduced back in May and June of 2015. And basically, in the Northeast right now, there's a huge problem with heroin overdoses. And we're starting to see that trickle down further south. So it's becoming a serious epidemic across the United States. And so our response was trying to get ahead of it. And after Mr. Raper, showed me the program, we got to digging into it a little bit further and thought this would be a great opportunity for Nashville and the state of North Carolina to get involved with this. We're the first police agency in the state of North Carolina to adopt this program, and there's probably about 50 around the country right now. Wow. So I'm sure that it will pick up as time goes by. But ultimately what it is those individuals who are addicted to heroin or some sort of opiate because they were using prescription medicines and now they've turned to illicit drugs, can come to the police department, turn over their drugs or their needles or any of that, and not face prosecution. So I think one of the first stops that me and Mr. Raper made when we decided to do this was the district attorney's office. And so we spoke to Robert Evans about what we had planned to do. And even before we even finished our conversation, he was 100% for it. So he said that he would back us whatever we needed. Thought it was a great program, and that he didn't see any problems with what we were doing. So from there it just kind of snowballed. And we put together a policy for the department so that officers kind of knew what to expect and what to do and how they were supposed to respond to this. And so when an individual comes into the police department to try to find help, we basically perform a service for them, kind of like a central depository. So we've collected a lot of different resources around the state to provide them help with their addictions.
Wow, that's fantastic. It's a very novel concept. And so if someone comes in and they don't face prosecutions, what are some of the helplines that the program is able to offer them?
First thing is, a lot of times what you'll find is they need some sort of immediate detox. And so we have partnered with UNC Nash Healthcare, Coastal Plain Hospital, and other providers around the local area and farther out to provide that initial detox. And so once they've gotten into that program, and it can last anywhere from 3 to 7 or 8 days, while they're in there, we will try to find them long-term care, because it doesn't do much good for someone that has a opiate addiction and coupled with that some sort of mental health issue to go through detox, get out in a week, and then go right back into the environment that they were in before they went in, and now they're using again.
Right.
The drug just has that much of a pull on somebody.
Have you, when I'm assuming the initiative is kicked off, have you had many come in yet?
We actually kicked it off February the 9th, and the initial response was through the media that we got was people were calling to volunteer to help.
Wow.
Which really helps the town a lot, because then ultimately we won't have to tie up police to do this.
Right.
But the volunteers are calling. We've got 3 pages of volunteers already.
Wow.
Right now we're setting up training to get them in and kind of walk them through what the program is. And I mean, it's going great.
What kind of training would a volunteer go through, and who provides that training?
We will provide that training. And most of the volunteers that have called already have some sort of direct tie-in to heroin addiction. Either their children have been addicted to it or are addicted to it. They know a loved one that has been through it or is going through that problem, and so they want to help. They understand that the process that an individual goes through and all the mental anguish that occurs not only within that individual but also family members. So they're going to be there to encourage them, help them through the process, to make sure that they know they're not alone. So the training basically is going to consist of making sure they're aware of what the specific policy is that we have, where we want them to go, how they can help, and those kind of things.
Does the department or the town of Nashville, do you plan to follow up with some of the people who have come in for help? Is there like a follow-up program just to kind of see if, I mean, getting them to come in first of all is extreme success. You know, that's for them to recognize that there's an issue and here are the drugs and I need help. Is there a plan for a follow-up on the patients?
That would be something that we would, as the town of Nashville, would be interested in doing, but that's totally up to the individual that would be enrolling in the program. Obviously, we would not give out anybody's name.
Right.
It would be a confidential type of thing, but if they were willing to sit down with the media to anonymously talk about their experience in the program, to try and encourage others to participate and receive help, we certainly would be open to that at the town of Nashville level.
Right. Have you received any calls from other townships or municipalities who may be interested in the same sort of program?
We have. There's been a few in the state of North Carolina now that's already contacted me and asked me to come and explain how we got our program started, because I know that they'll probably look at something similar to that.
Right. Are there other programs out there in the United States that, we all know that opioid addiction is a huge problem in the United States, but are there other programs that you may be looking at that offer the same sort of service for perhaps a different type of addiction?
Although the program is kind of centered around opiate addiction, if somebody came into the police department and had some other addiction to some other drug, crack cocaine or whatever it may be, we're not going to just turn them away. We're going to use those same resources that we have for the opiate stuff for those addictions. Because the drug addiction itself is one aspect of this. There's also a mental health issue that goes along with that. So the resources can be used for the same things.
Right.
And part of our program someone can walk into the police station with possession of drugs at that time, those drugs can be taken from them without any criminal charges pursued at that time. So we don't want to create some type of technicality where someone walks in with a different drug other than an opioid, and they feel that, oh, we're targeting them because they came in with cocaine versus heroin. Our program really is to reach out and help people. We do not do any type of police interrogations when they walk in the door. It's truly designed to assess their situation and provide them help in treating their addiction.
What has been the community response?
The community response has been overwhelmingly positive. I think we've heard many positive comments about this, from social media through face-to-face interactions. Council's very excited about it. In fact, at this point, I haven't heard the first negative word about the program whatsoever.
It doesn't seem like there would be much cause to have a negative, when you're helping people in the community, especially. If someone was interested in volunteering to help the program, or perhaps provide financial assistance, to help everything else, who would they contact?
They can contact the police department. So our phone number is 252-454-4545. My extension is 222, or they can email me. They can find that email address on the internet. And so if they want to provide some sort of financial assistance to anybody that's going through the program, or just a volunteer, they call and leave their name and number, then I will call them back.
Are people who may have the addiction problem, can they call that number too, or they just kind of walk in, or?
They can call that number, they can walk in, they can call, or they can contact any of the police officers that work for the town of Nashville, to include any of the sheriff's deputies that work for the Nash County Sheriff's Office. Sheriff Stone has been extremely supportive of the program and helped us launch this back on February 9th as well, and said that he was fully supportive of it.
Oh, fantastic, fantastic. Well, we're looking forward to maybe following up in several months and see how things are going. Well, thank you very much for joining me, and I'm sure we'll see you again very soon. And Chief, thank you so much for being here, and I know we'll have you back on the program for sure. So thank you very much.